Let's take a brief break. The microphone isn't on. So we'll make sure
Sorry.
screaming can hear. Sorry about that.
Okay. Now you're back.
Forget.
Sorry.
So how do we get started? We need a DD-214. This is the veteran's military discharge from active duty. DD-214 with the Register of Deeds. They also give out little ID cards that you can have and get discounts, things like that. But also, if you ever lose it, we have hurricanes, if there's a flood, something happens, you can always go get it from the Register of Deeds versus having us go to the NPRC and all this kind of stuff. Because sometimes it can take a while, it can be months. Now, it can be expedited for medical issues, terminal illnesses, as well as burials. So we can try to get that expedited. But that's another reason why you would want to have that readily available at the Register of Deeds. Now, one of the confusing parts, kind of like the first slide, that we work in all these different levels of government. So we're going to break these different ones down. As VSOs, the Veteran Service Officers, the bulk of our work is going to be with the Department of Veteran Affairs. And within that, there's an administration, the benefit side, that's the bulk of our work, but we'll talk more about that. But again, so we are supervised, trained by the state. We'll break down Department of Defense and then all of our work with VA. North Carolina state benefits. So you're riding around, the disabled veteran tags, military tags. So we sign off on those. So there's a form that you can come in. You just have to show us proof of what tag you would like, and we actually sign off on those, and you can take them to the DMV. Lifetime hunting and fishing license. If you're 50% or more, then we sign off on those. For you to get a lifetime hunting and fishing license, you would send that to the state. Property tax exclusion. You have to be 100% permanent in total to receive that. That's where you receive $45,000 off of your property value, and you pay the difference. So that's a benefit that's with the state. The state also has a scholarship. There are different levels of that, and there's more information on the table in the book about that. But there is a scholarship that's not VA, but if you're a wartime veteran in North Carolina, different levels of disability compensation, your children might be eligible for a scholarship. State also operates nursing homes. They also operate cemeteries. Our Jacksonville is the closest one to us. And then the nursing home between Kinston and Fayetteville, I guess those would be the closest to us. But in that resource guide that the state puts out, all of that information is in there, the criteria of how you can get into that. So those are state benefits and how we interact. Now, when it comes to the Department of Defense, most of our work with them is more of an information-based liaison, kind of helping you out, because we have no access to Department of Defense systems. So because that's active duty military, retirees, but these are the most common questions we get or situations we get asked about. So annuitant services, so if there's a survivor benefit plan, once the veteran passes, that's through DOD. So when the veteran retired, they elected to whether to have that or to not. We get questions about that. We have no access. We know about the forms. We can inform you of where you should go when you do that, but that's not VA. DOD ID cards. So retirees have that, but if you are 100% permanent in total, then you get access to that. So then that's where you would schedule an appointment on base and get your card and things like that. So again, we don't do the ID cards. That has to be on base. We did have on Carolina Beach Road, there used to be at the Reserve Center, they would do them, but unfortunately after COVID, they shut down. They used to do them 2 days a week. So now you have to go on base to get those. Then the CRSC, Combat Related Special Compensation. So some veterans can file for, say, one of your conditions that you're being paid compensation for was a combat or stimulated war. You can apply for that. Again, not VA, that's DOD. 1099s, people ask us, can we get those for them? We can't because that's DOD, but we can tell you how to get that. And then discharge upgrades. We do assist with this because these go to that branch of service. So if someone has a dishonorable or other than honorable and they're trying to get that upgraded, it would go to the different branches. And we can kind of assist with that. But a lot of the schools, the law schools, also help with this. So we can help you fill out the application to see if they can help you get your discharge upgraded. So then, Department of Veteran Affairs. So you have VA, but there's actually 3 administrations within there. So the side that we work in the most is the benefit administration. So that's all your compensation, pensions, basically the money, the checks that are coming out. That's your benefit side of the house. Then you have the healthcare side. So that's your clinics, hospitals, outpatient clinics. Then you have the cemetery, your headstone markers, memorial certificates. So we don't have access to your VA health records unless they come over to the benefit side of the house to support a claim. But we can help you as a liaison navigate the healthcare side. We can help you get enrolled. You can't get in touch with someone or something like that, or you want to know more about their programs, we can assist with that. So this is kind of break it down of what we do in our office. Disability compensation and pension is the bulk of our work. But also VRNE, like vocational rehabilitation, if you're 10% or more, say you don't have GI Bill eligibility anymore, you just rather go that route, we can help you get that retraining. The memorial benefits, burial, healthcare. We talked about requesting our records. The VA life insurance, which just changed this year. There's some more information on that of how you can apply. We get home loans, a lot of questions about that. And I talked about vocational rehab and character of discharge review. So this is one of the important things. So we talked about getting your discharge upgraded, but there's also a character review. So say a veteran had an other than honorable discharge. That is, that doesn't bar you from all benefits. So some veterans will be told, oh, I'm not eligible for anything. But if we can ask VA to review your discharge, you might not be able, they may service connect you, but can't pay it out. And you would get what they call Chapter 17. So you can get health care. You may not get access to home loans. There's different things. So we always tell veterans, don't just say you're not eligible without talking to a accredited representative. And another thing is, if you had multiple periods of service, you may have had an honorable period and then another period that's not honorable. So we can file for conditions under the honorable period, or you can get more benefits under an honorable period. So people, if you had multiple things, you want to make sure that VA is looking at your full terms of service, because then we can access some benefits that way. All right. So let's break down some of these. So disability compensation, that's that tax-free monthly benefit. And this is from a disability that's resulting in an injury or disease that occurred or is aggravated by your service. And the three things when it comes to service connection, VA is looking for an existence of a present disability. So you have to have it now. You could have had it in service. If it went away, wasn't an acute thing, then you got to have it now. Then you have this in-service incurrence or aggravation. So there's a marker, something in service, you served in Vietnam, you exposed to Agent Orange, or you went on sick call. There has to be something that happened in service. And then we need what they call that nexus, a causal relationship between the present thing and then what happened in service. So when VA is denying, it's because they can't find one of these things. So it's our job to give them that or show it in your records or speak to your doctors to get those nexus statements that give you that relationship. So that's our big one. And once you get it service connected, then VA will assign a percentage. And those that know about disability compensation, it is not regular math. So you can't add it all together. Yes, they have their own math. So, and just to keep it pretty, I'll say simple as I can, clear as mud, VA, that formula that they have is supposed to be what you would lose in the workforce. How they come up with that formula, but that's the justification of what you're being paid in that percentage. So, so if you are 10% service connected, now remember each condition has its own rating, and then there's a combined rating. So your combined rating is basically when they say, what's your percentage? That's your combined. But each individual, so tinnitus, the ringing of the ears is a common claim. That caps at 10%. So not everything's going to go to 100%. So each thing is rated, but you don't add them together. VA has their math and you have a combined rating. And even though this is the benefit side of the house, that rating can help you in other areas when it comes to VA, such as the healthcare department, the healthcare side of VA, because they have their priority groups. So it's important to kind of know that and always understand when it comes to disability compensation, there's multiple ways to get it. You have your direct, meaning you hurt your toe, it came straight from service. You have a secondary. You had a bum knee, you've been favoring it, now the other side hurts. So now you're filing for a condition that's secondary to that, or diabetes. You that came from Agent Orange presumptive. Now you have neuropathy from your diabetes. That's secondary. So some people they don't connect them. So that's why it's important to talk to your doctors. Did this cause this? Because then we can go in. If you have a pre-existing condition, then you can always say, well, the military aggravated this condition. And that's another way to get it service connected. So always be thinking and in communication with your doctor, because this has been connected, because that's another way that you can get your disability increased. Non-service connected pension. So this has some requirements regarding when you served. So if you served 90 days in the military, now after 80 it's generally 24 months. At least one day during the wartime period, and I'll show you those different periods. Now if you're over 65, VA just assumes you're disabled, so you don't have to worry about anything. But if you're under 65, then you have to show that you are receiving Social Security disability or you're somehow disabled. And then the disability does not have to be related to service. That's why it's the non-service connected pension. But you have to be within income limits, and I'll show you those. So these are the wartime periods that VA recognized. Now you see Vietnam they have a little more. So if you were in Vietnam, they'll count from February 28th, 1961. If you weren't, then your period's going to be 64 through 75. Remember, before 80, just need 1 day within that. Then you have the Gulf War. VA recognizes us as in conflict since 1990.
Could you go back?
Yeah.
It's just a button that let me see something.
Mhm.
So, okay. Oh, it has.
So looking at 90 days active. So, and they're talking about, say you went to basic and then you went into the reserves. So that's that. So reserves is considered active duty for training. That's not regular active duty.
So I just have a question.
Yeah.
So I did active duty
Mm-hmm.
from, December 81 to, I think it was June of 95.
Mhm.
It was reserve duty, it was active duty for 3 years, or 24 months and whatever, so I got the active duty status. And then in between there, I went to a captain's course, and then at the end, I got discharged, but I don't get a pension because I didn't do the points, all the points that were required.
Right. So,
in
and
IRR during
the ready
Gulf
reserve.
War.
Okay. So when it comes, and VA uses pension. So the question is, she didn't have the points to have like a regular retirement or the 20-year
Right.
period. And so VA uses pension, but it doesn't have anything to do with like retirement or 20-year or anything like that. You just have to have that eligibility. So it sounds like if you have 3 years of active duty service, you have more than enough time for active duty. So then and then you said from
82, well, 81 December, I say 82 to 95.
So then you're after 90. So 90 is when another wartime started.
Right.
So then,
Because I was callable. I was in the IRR, so they could have called me up.
okay, after that, but your 3-year period was prior to 90.
Yeah. Right.
Gotcha. So then in that case, then unless something happened while you were on drill or because you were in the ready reserve,
Right.
then you wouldn't necessarily be, that's not active duty.
eligible.
Yeah, that's not active duty time.
No.
Right, so you wouldn't have an active duty period within that wartime period.
Oh, it has to be right in that.
Yeah, so the active part. So you got the 90 days, then you have to have 1 day during a wartime period. So your active duty was during peacetime.
Right.
Mm.
Thank you.
Yeah.
I was trying to clarify. Am I missing money that?
Oh, no. And yeah. So, and then that brings up a good point with compensation for those that were in the reserves. So it's a little different when we file a claim for someone who was in the reserves because they want to see a line of duty. So if you got hurt, say that weekend or during your 2 weeks, they're going to need paperwork to show that. Otherwise, they can't tell whether you did it then or during your civilian time. So that doesn't mean you can't file. It just means your burden of proof is a little different. So those are our wartime periods. And then I'm going to go into the income after this one. So when it comes to VA survivor and dependent benefits, there's 2 programs, and we're only talking about VA. So there's a survivor pension, which also operates just like the veterans pension, like the wartime. The veterans still had to be within a wartime period. You still have to meet income requirements, and you can't be like remarried after the veteran passes. Some people refer to it as the death pension. DIC, the dependency indemnity compensation. So this is kind of like the disability compensation for the survivor. And this is paid to survivors, so it could be children, dependent children, 23 and under, and the surviving spouse. The veteran died while on active duty for training, or inactive duty for training, or a service-connected disability. So say, and it has to be on the death certificate. So say a Vietnam veteran that was exposed to Agent Orange passes of a heart condition, and it says that on the death certificate, then VA can pay out DIC because that death was technically service related. Now, if this veteran is 100% for more than 10 years, permanent total 100%, more than 10 years, the cause of death no longer matters. They will pay out DIC. So this, yes, ma'am.
Is there a certain income level for that?
For DIC,
Yeah.
no.
Yeah.
Pensions, the only thing that's income based.
Okay.
Yep, so DIC is plainly either 100% permanent total for more than 10 years or the veteran died of a service-connected condition. Remember, service-connected, that's something VA is paying for. So if they were paying for diabetes, heart, it's on the death certificate.
Okay. I was under the impression that in order for the spouse to get it, the income had to be.
Right, no, that's only for pensions.
Okay.
Only for pensions. Then another thing with DIC, say the veteran just didn't want to file or they didn't know for whatever reason. There's an example I had a spouse come in, their friends were like, they keep telling me to come ask if I'm eligible. Veteran died in 97 or something like that. Died of lung cancer. He was a Vietnam veteran, never went to VA healthcare, never filed a claim, nothing. He didn't want anything to do with VA. She comes in, we file for DIC because lung cancer is a presumptive of Agent Orange. It was on the death certificate. So she was able to get DIC, which is about $1,500 right now a month. It's not income based, and then there's some you can add on some different things. So the veteran didn't necessarily have to file to get that. Yes.
For the, just from a pension standpoint, are veterans able to like indicate if they want a certain percentage to go to their spouse after they pass? We're going through this with my grandfather who's in the Navy. He's 90, he has his Navy pension, but then he just filled out paperwork for that to go to my grandmother when he passes. So I don't know how that all works.
So it sounds like DOD. Is he retired? So yeah, so at retirement, from my understanding, that veteran can elect whether they want the survivor benefit plan, SBP. So unless he got remarried or different life situations, that's when you can change who it's going to or elect that.
So that's under DOD.
So that's DOD. Because once a veteran passes, all his VA benefits stop. The spouse has to now apply for one of these. Now, when it comes to DOD, that's different. So if they have a survivor benefit plan, they may be eligible for money outside of VA. And then they were doing an offset that recently stopped this year, where before they would offset the survivor benefit plan and DIC. Now the spouse can get both. And aid in attendance. We get this question, or a lot of people call and say, hey, I want to file for aid in attendance. Aid in attendance is not a standalone benefit. It must be attached to a pension or compensation. So you have to be eligible for one of those before you can get A&A. All it is a special monthly compensation. It's on top of another benefit. And these are the requirements for that. So at least one of these have to be true when it comes to your daily living. You need another person to help you perform those daily activities like bathing, dressing. You stay in bed. And I think so. And if you're in a nursing home, things like that, there's another form that you can get that shows aid in attendance if you're in skilled nursing, things like that. But again, it has to be attached to a pension or compensation. And when it comes to compensation, so I'm talking about disability compensation, when it comes to that, your reason for needing aid in attendance has to be a service-connected condition. So if you are not service-connected for your heart condition and that's what's causing you to really need assistance, or if you have some type of disability that's really helping you, but you're not being paid by VA, that can't be attached to the compensation. Now, if it's non-service connected pension, then it doesn't matter. You just need the help because remember, it's not related to your military conditions. And this form, a doctor completes this form and then we send this into VA for them to determine. Yes, ma'am.
So this isn't a monetary benefit, this is assistance in the home?
Nope, it's monetary. So benefit side is only money.
Okay.
Only money.
So you said if it was attached to a compensation, but if it wasn't service related, let's say you got Alzheimer's and you
Mhm.
needed it, then
Mm-hmm.
you can't apply.
Not if you're attaching it to disability compensation
No.
Right.
But can you apply through
for the
VA
pension.
healthcare?
Yeah, so VA healthcare, and we'll talk a little bit more about that, but they have, if you're enrolled, you can talk to your primary care doctor and they can put in a consult that can get you care in the home through their third parties or their contractors. But remember, so that's the healthcare side of the house. Mm-hmm.
So for retired military,
Mhm.
and someone needs aid attendance, it's not gonna be through, seeing compensation to the VA. Let's say they don't get any, but they can apply through DOD, is that correct?
So no, so
Through
DOD,
TRICARE or-
so TRICARE, and that's it, health insurance. So it would depend on what TRICARE covers. So yeah, because that's a DOD. That's different from VA healthcare.
Okay.
Mm-hmm. Yeah. So he was just saying, if you're retired military, could DOD or TRICARE cover that? And yes, you would have, TRICARE is your health insurance, so you would have to see what they cover, but that's not VA.
How do they look at this with, like mental health diagnoses that are like service connected? I'm just thinking more like PTSD with like some of our younger veterans and things like that. I'm just curious how this connects to that.
So in that case, on this form that they fill out, so it's going to ask the doctor all these questions. It's going to ask what diagnosis it is. So if they put this PTSD and they need help with, and they check what's med management, they can't handle their funds, they need help dressing or whatever that is. Depends on how that form is completed, then it goes back to VA for them to look at that. And in that regard, if it's service connected and the doctor says that they need this, they filled it out appropriately, then VA should grant aid and attendance. And again, that's money. They don't set up the in-home care for you. Mm-hmm. Now, this is the housebound eligibility. We see it every once in a while, but for the most part, VA pays out aid and attendance, which is a higher benefit than housebound. And then you'll see the note, you can't receive aid and attendance and housebound at the same time. VA is going to pick which one to attach to your pension or your compensation. And these are the pension rates for a veteran. So if you don't have any spouses, and you'll see the columns, if you don't qualify for the aid and attendance, then you'll be the 16,000. And if you qualify housebound, you see it gets a little more, and then at the bottom, and this is the max that VA can pay out annually. And what happens is, if you say it's 26,000 for a veteran needs aid and attendance, if your income's over that, VA can deduct medical expenses that you have out of pocket, so you had already had to pay them, and it can deduct your income. Once your income goes below that, VA pays the difference.
Do they base it on a joint income?
Yes. Yes.
So it's
The household. Mm-hmm. So they were asking if they count the household income, and that is yes. You had a question? Oh, I thought you. Oh, okay. And then the same thing for a dependent. Now, so if you get zero, then of course they're going to pay that full amount. So assisted living, in-home care, things that you're paying out of pocket, all those are medical expenses. VA has like a 5% deduction rate. So after 5% of the max, they'll start counting. They do have an asset limit, 150,000. So, and that's not counting your home, that's not counting cars or anything like that. So that's the bright line for asset limits when it comes to pension.
So what's the MAPR?
That's the maximum annual pension rate. So that's the most VA can pay out. So that's what your income needs to be below that for them to pay the difference. And if your income's above that, you can use medical expenses to make it lower.
Okay.
Mm-hmm. And this usually goes up every December with the cost of living. And remember, this is just for the veteran. Mhm. That's why we have jobs. Yeah. So yeah, Oh, that's my question. So yeah, mainly you would total up your income monthly, and then times it by 12, get your annual rate. If you're over that, you also want to look at what your medical expenses are. So what are you paying out of pocket regarding medical for you and the veteran? And then you deduct that to see if you come under that. And this is a benefit that's always available. So say you're not eligible now, and you start having more medical needs later on, and then you're eligible.
But, so if your spouse is not a veteran, you're the veteran,
Mm-hmm.
then all their medical expenses could be deducted?
Yes, ma'am.
Oh, 'cause-
Mhm.
Thank you.
Oh, I keep forgetting to say that. So the question was if the spouse, if she was the veteran, and she can deduct her spouse's medical expenses to bring her below the pension rate. Mm-hmm.
Does the medical expenses include if they're paying a monthly premium for an insurance policy? Is that included?
Yes, any medical expense, premiums, dental, eye. And I will say, when you are establishing a pension, VA is going to use reoccurring medical expenses. So like your premiums, if you have an in-home attendant that you're paying regularly, because if they use prescriptions and things like that, that can go up and down every month. So they can't really establish what your monthly would be. And what they do with that, so say you use those reoccurrence, you got pension. And then the next year, they give you a full year to let them know anything you paid out of pocket that's not reoccurring. So say you had to buy a hospital bed or something like that, then that next year, you can let VA know, hey, I had this huge expense. And you still have room within that. You didn't cap out of the maximum pension rate. They can reimburse you for that. They just can't use that at the time. So yeah, that's why. So we have jobs.
I'm still confused
Yeah,
about it being a pension,
Mm-hmm.
because I don't.
Because of the
qualify for
word.
pension.
So yeah, and that confuses. And if you need to, it's not like a work pit. You work this amount or you serve this amount of time, so you get to get it. It's a wartime era. So that veteran served during a wartime era. You meet the income requirements, and you're either over 65 or you're disabled. So they say we will provide a pension for you. They just decide to call it a pension, but it's not. It doesn't operate like, oh, I worked 20 years or I'm vested for 5 years. Mm-hmm. So your military, those are the only requirements when it
It's
comes to
just kind of
service. Mm-hmm.
But you said.
And that wartime period.
Oh.
Wartime period. Mm-hmm. Did I see another hand? Surviving spouse pension operates the same way. So remember that veteran still had to be in a wartime period. And these are the income. And you'll see they're much lower than the veterans. So unless the surviving spouse has a lot of medical expenses, if they have Social Security, sometimes that's gonna bump them out of that. Because you're looking at, if you don't need aid and attendance or anything like that, you can't make over the $10,000 in a year.
Yeah.
And that net worth should be, it didn't update, but it's the same as the previous one. Should be. Any questions about that pension? All right. Healthcare eligibility. So now we're switching to the healthcare side of VA. So you may be eligible for these benefits if you served military, naval, air service, and you didn't receive a dishonorable discharge. So that other than honorable, all that kind of stuff, that still can get you into eligibility. You can still get VA healthcare in most cases. If you enlisted before September 7th of 1980 or entered after October 16, 1981, you must have served 24 continuous months or the full period in which you were called to active duty. So if you were a reservist, you got called for 9/11, and you serve your full contract, then that's your full period of service. So that's what they mean by that. Now when it comes to VA in general, you can tell it depends. So if you are service connected, that goes out of the window. If you even early outs, hardship, things like that, that wasn't the veterans. It wasn't like you got kicked out or anything. So those different things you served prior to 1980, those are other things that can get you enrolled outside of those periods. If you served in certain locations and time periods, if you served in Vietnam, then you're going to automatically be enrolled under a certain priority group. You may have co-pays, things like that, certain medals, Purple Hearts, certain things that'll also get you enrolled in VA healthcare. Now, a lot of people will go to the VA clinic and they say, oh, you're not eligible, your income's too high because it's a household income. And then maybe they'll send us over to our office and say, well, hey, you were here, you need to apply for a claim. And then if we get you service connected, then your income no longer matters. So that's why it really depends when it comes to that health care. If you're a current or former member of the Reserves or National Guard, you must have been called to active duty by federal order and completed that full period. If you had or have active duty status for training purposes only, you wouldn't qualify. So, but that's without you being service connected or anything like that. So if you just drilled, never got called, you're not receiving anything else, you wouldn't be eligible for VA healthcare, unfortunately. One of the things that I really like to go over when it comes to our area, Fayetteville is our parent VA hospital, and it's so far away. So if you have an emergency, you're going to go to our hospital. You have 72 hours to contact VA to let them know of that emergency. So that will help because it can impact their ability to pay your bills. And it also just helps for smooth transition. We're trying to get, the hospital to ask those questions. Are you a veteran? Do you go to the VA? That would help them with billing and filing claims. Because there's some information that just the hospital doesn't collect that they're going to need to file that claim. So it's always important for program it in your phone, let your spouse know, but always call if you're going to a non-VA hospital, and that's anywhere. And I don't know, some people may have grabbed some things off the table. VA does have the caregiver program that a lot of people don't know about. It does have some requirements. You have to be 70% service connected to get the stipend portion. So there's VA can pay a caregiver, and it can be a spouse, friend. They can pay a caregiver for that. But there are some criteria, with one of the main ones that veteran has to be 70% or more to receive that. But outside of the stipend program, they do provide a lot of resources to caregivers. There's a caregiver support line, things like that, that I think people should really take advantage of and know about. Yes.
Is the spouse eligible for that, the surviving spouse,
For the caregiver?
caregiver at home?
No. So VA, and this isn't in here, VA does not see spouses' dependents. They don't treat them. They have Champ VA, which is a health insurance. So if
Right,
you're,
I have that.
so, and then if you're a surviving spouse, then you would get that. Or if the veteran's 100% permanent total. But yeah, the VA, none of their programs would go directly. So that caregiver support, that's the only way they pay a spouse. If the veteran is receiving care and in that caregiver support program, then they can pay a spouse.
Okay.
Mm-hmm. Yes.
Is that stipend that you mentioned, is that like a monthly stipend, or is it based on, is it vary, is it the same for everybody, or based on income?
So no, there are levels to it, but it's based on severity of that condition. And so there are different levels that you would meet that are already determined once you go in. And so once you apply, because all we do is help you apply for that program, and then you'll get a call from the staff at VA. They'll interview you, see what's going on, and see where you would fit if you're eligible for the program, and then which level would you be eligible for based on the veterans' needs.
And you said that can be a spouse who's already caring for them?
Yes. And if the veteran's not married, they can identify the caregiver. So it doesn't have to be a spouse.
Can that be transient? For example, if a veteran, the spouse, has to have surgery and it's a temporary episode, is it?
I think it has to be at least 6 months.
Okay.
Repeat the question.
Sorry. So could it be if it's a short period of time? So say it was surgery and they needed care over a certain time. I know there's some eligibility criteria that says that it has to be, you needed that care for at least 6 months.
Do you guys help veterans with the like homemaker like VA program as well? So where the VA doesn't necessarily like stipend the spouse, but they'll pay a home care company to come in and provide care.
Nope. So that's healthcare as well. So you would want to, if you're already enrolled, you would talk to your primary care doctor for them to put in a consult for that type of care.
I wasn't sure where it fell under
with the administration. So she was asking if it's not the stipend program, but do we assist in like identifying and helping getting in-home care? And again, that's going to be the healthcare side. You would talk to your primary care doctor to put a consult. So when it comes to VA healthcare, everything kind of flows through the primary care doctor. So that's why we tell veterans, even if you don't want to use the VA and you're fine with your non-VA providers, get enrolled and just go to your physical every year to stay active, because they have so many different programs that either they're new programs or just existing that we don't know about that you might need. And you don't want to have to get into the red tape of, oh, I can't get in for a few months to establish care. And you have to have established care to get to some of these programs. So we always tell veterans, just enroll so they're there if you need them for these different programs, because they have, there's a program called the HISA. They like acronyms. I can't remember what it stands for, home structural, something like that. But it's a grant that your primary care doctor can put in a consult for, and they can help if you need to remodel your bathroom, you need a ramp, you need different things on the home, but that's administered through the healthcare side of VA. So you need to be enrolled to get access to these things. So that's why we say, just, if you're eligible, enroll, go and just learn about some of the things you could be eligible for, because it could be later and you don't have to, worry about that. It's just having that conversation with the doctor or the social workers to get you enrolled in that program. And how do we do that? Multiple ways. VA's pushing a lot of stuff online, so you always can apply online. You can go to the VA. We have the eligibility lady now, Miss Cherie. She's awesome. She can help you get enrolled, get your ID card, because we get a lot of questions about ID cards. But you can actually get on base with your healthcare ID card if you're service connected. That was passed last January. So if you have a VA health card service connected, you can actually get on Campus June and base with that.
Yeah, you have access to the commissary, to the exchange, to all the recreational facilities.
Yeah. So there's another incentive for you to get enrolled if you're service connected. But you can always mail it. The headquarters is in Georgia, and that's the phone number if you have questions about enrollment. That's the national number, and they're open till 8 Eastern time. And we always, like I said, we always can help you fill out the form. It's a 10-10EZ. That's the form number, and we can send it over to the clinic for them to process that. Now, mind you, we do have a clinic here, so the time, it might take a little time to get in, but I think it's well worth it for some of the benefits you would have access to. So like I said, our medical center is Fayetteville, Ramsey Street. So sometimes if the phones, you might get Fayetteville, they can transfer you to Wilmington. If you can't get in with someone in Wilmington, you can call Fayetteville. If you know who you're trying to get, then sometimes we can help you get to that person. And it's over by the airport for those who don't know where it is. That's our clinic.
It's nice.
So some of the hot topics, things that are going on. So you probably heard commercials, TV about the PACT Act and Camp Lejeune water. So it's a lot of stuff buried in the PACT Act, a lot of stuff. For the most part, so you have your burn pits and things like that. So there's a presumptive, I think it's 29 presumptive conditions that they've added if you served in certain locations. So if you look at on the table, I have some forms that tell you about all those locations, and that affects also Vietnam era. So it's not just post 9/11, but Gulf War, all that's in the PACT Act. And one of the good things about Vietnam that has helped a lot of veterans that I've helped, Thailand. So a lot of veterans that were not in Vietnam, they served in Thailand. For the longest, they only were saying the perimeter. So if you couldn't prove that you were on the perimeter, they would not grant your presumptive conditions. So now it's all of Thailand. So that's helped a lot of people. And it also helps survivors. So that's why we always talk to, we ask people, did you serve in the military? Not, are you a veteran? We just asked if you serve. Because some people, depending upon the criteria that they've been told, they don't feel they're veterans.
I didn't know it was a veteran.
So that's why we all, did you serve? Did you take the oath? And then we'll go further and ask more questions after that. But you also want to ask a spouse, or did your husband, did your wife, did they serve in the military? Because since these things are coming, just like the example I said before, hypertension has been on the cusp forever when it comes to Agent Orange presumptives. So if that's on a death certificate of a veteran, or say he had a heart condition or a stroke or something like that, and we can tie it, then that spouse now can get DIC, whether the veteran had been passed for so long. So it's not just about veterans. We also want to ask about the family members. And so that's really, really important information. When it comes to Camp Lejeune water contamination, the VA has always had a presumptive list, just like Agent Orange. But you'll hear the lawyers and things like that. That's not VA. So a lot of people will come to us and ask, like, do I need to get a lawyer? Can you help me file? Now, you don't have to get a lawyer, but you can. But that, the Camp Lejeune Justice Act used to be a separate thing. Then it came up under the PACT Act and was passed. So that's why all this stuff is kind of together. But you still have to, that's separate, that's not a VA benefit. Now, you can apply for VA compensation. So one of bladder cancer is a presumptive of the Camp Lejeune contaminated water. So a veteran can file for bladder cancer with VA and receive that compensation. You also can get an attorney and go file with this lawsuit, the class action, the Justice Act. So you can do that. And a lot of people were asking, what is that going to do to my VA benefits? So as of right now, it's not going to do it's not going to affect your monthly benefit or anything like that. But say if you were awarded a lump sum of money by going through a lawyer and attorney to do that, if you are awarded that, then VA may offset that. It's not going to do anything to your monthly, though. It may affect your award. And I think with the Camp Lejeune Justice Act, it's really going to help people that are not veterans, civilians that were there, family members, because they had no avenue for compensation prior to this. So we tell veterans, at least always see what your options are with VA. can you file for that monthly disability compensation? And if you choose, you can seek a lawyer and go that route. Now it's going to be a long time coming when that for that to even to pan out. However, I always just say talk to your lawyer and make sure you have, if it's not to your benefit, you want to make sure you can get out of that as things are still developing. Yes.
The Camp Lejeune water contamination,
Mhm.
is that being compensated? It's not being compensated by the government, isn't it the chemical company that's paying out?
Yeah, because it's like a kind of like a lawsuit. Prior to the signing of the PACT Act, you couldn't sue it. Like you could not do that. So once they passed this, that lifted that, and now you could actually they could sue and be compensated for that. Now who's paying it out? Because we're not involved in that at all.
Yeah.
It's more so we talk about how that's going to affect VA, and that is not VA. That's kind of how because we can't help assist with any of that.
Yeah, okay.
Mhm. Yeah. Alright. So then VA also has a new life insurance. Prior to like if you were service connected, you had 2 years to apply for VA life insurance, the disability life insurance. So that went away in December. So now it's open to, it doesn't matter when you got service connected or anything like that. You can apply for this benefit. I think as long as you're under, I think it's 80, then they have premiums for that. So that's a new. You can't get in the older life insurance program. Yes.
Is it term or whole life? What is it?
I'm not sure. I have some. We haven't done any yet. Like I said, it just came in January. We try once people get service connected, and she was asking if it was term or whole. Once people get service connected, we would always let them know, like, hey, you have a new condition. You got 2 years to file if you want this life insurance. But we haven't had anyone that has enrolled in the new one yet. So I printed off some of the new things that have premium, the rates and things.
So they'll still cover that, the insurance company, VA Life will still cover that with disability?
Yes, especially if it's service connected. Because it's that's outside of she was asking, would VA still cover some with those service connected disabilities? So yeah, they wouldn't count. Now, if it's not service connected and you have another condition, then that's different. That might come into play.
So
But
they'll
if
take on the risk.
Because it's a service connected condition. Then the Compact Act has some information over there. This is for newer veterans, but it's mainly to help with the mental health initiative. So if a veteran even if you're not enrolled in VA, you need to go to the emergency room. If you're having a mental health crisis, they will take you and VA will cover that bill. So that's new. So there's some information over there. So really, really trying to help do their part in making sure people are seeking the treatment and there are not all these barriers or doors. So especially here, our clinic closes at 4:30. So you have the crisis line, but then you're going to have to go to the emergency room. So we want to make sure they're not being billed for that. So definitely pick up some of that information. And then we talked a lot about that caregiver support program. And the reason why it's more of a hot topic is it's not new, but it's changed every year for the last 3 years. There were some phases in. So it started with post 9/11 veterans. So before, that's the only people who were eligible. Then the next year, they went to Vietnam and before. And this past October, now they do the whole range. So that's why it's still trying to get that information out there and understanding what that program is and who's eligible for it. So definitely look at that. You can apply online. It's very, very easy application, and they contact you to do the assessment and go forward with that. Then important numbers. So that first number, the benefit assistance line, that's kind of a catch-all for VA. So if you have general questions need forms, assistance like that, they can help. Then you have your healthcare benefits line. That's going to talk about all the administrative side, help you with eligibility care, giver questions, all that. Education, 9/11 dependence education, all that. You can catch that there. Homeless veterans. So if you run across a homeless veteran and you contact this number, they will send it to that homeless care coordinator in that area so they can work that. And it's usually within, I believe, 48 hours they have to contact. So that's always a good resource. You know, the National Suicide Hotline has changed to the 988 number. So we always want to share that.
Betsy, we have
Yeah.
one question from online, and you might have answered this, but to be considered for the VA caregiver support, do they go through the VA primary care or through your office?
So it's a form. So it's a healthcare side that's the healthcare side of the house. So they can go through there or they can come to our office. We can assist them in filing it. We would go online and just complete the application. Mm-hmm. And then pension benefits line and the caregiver support line. So this will give you more information about eligibility, checking on your application. If you appealed an application, they can assist with that. So that's a really important number. Then you have retired pay or DFAS. So that's at DOD. If you have questions about annuitant pay, survivor benefit plan, all of that, that's where you would call. I always put DEERS in here just because some people say if you become 100% permanent and total, you're not a retiree, therefore you're not going to be in the DEERS program. Your information is not going to be in there. So to get that updated outside, if you go to certain places, certain people will do it, and then others may just tell you you need to contact DEERS. So that's what that system, that number's for. Then you have the CHAMP VA, what we talked about earlier. So that's the dependent health insurance for if you're 100% permanent and total. Now, if you also are a retiree, TRICARE trumps CHAMP VA. So if you're entitled to TRICARE, you can't get CHAMP VA, even if you're eligible. And also caregiver program. If you don't have health insurance, they can give the caregiver CHAMP VA in that program. Yes.
Would CHAMP VA be secondary to Medicare?
It's a secondary payer.
Secondary
Mhm.
payer, okay.
So if you don't have any, then it's primary. And once you get enrolled, they send like a big book and explain what's covered, what's not, how to claim. And if you don't get enrolled, but you were, say for whatever reason, VA has your effective date prior to when you were enrollment, sometimes you can file claims on that. So the question was, is CHAMP VA a secondary payer? Then we have resources. So I have some of the state resource guides. There should be one coming out this year, hopefully, a new one. But this is the link to that. You can find it on the state website. Then you have the VA federal benefit booklet. So it's going to go over all of VA's federal benefits because there's so many different benefits that are out there that just for the sake of time, we're not going to go through, but you always want to look at that because it's going to cover veterans, dependents, and survivors. Then you have Planning Your Legacy VA Survivors Benefit Kit. I think this was last updated in 2020, but I think it's really, really good because it tells you kind of like the information you need. It gives you samples of the forms. Now, VA updates their forms all the time, but they only tweak them for the most part. So the forms may be a little older. However, the information is still there. So it talks about what do you need, military honors, the different survivor programs, things like that, all in one place. So just planning your legacy, burials, cemeteries, national All that's in there. So I think that's a really good resource.
I need that one.
So it's I wish I can't find any printed copies, and they won't send me any. So right now I only have the link. But but if you any of this information that you'd like or want to know more about, I do have a sign-in sheet, and we can always email you, set up an appointment if you have questions, or get you to the appropriate source that you need. And we are housed in the Health and Human Services building. We sit in between 16th and 17th Street, down from the hospital, open Monday through Friday, 8 to 5. Every third Thursday, we go down to Carolina Beach. So we go to American Legion Post 129 from 9:30 to 12. Then we go over to the KB Hines Senior Center in Carolina Beach from 1 to 2. And every last Friday of the month, we just started in February going to the Castle Hayne Baptist Church location that the Senior Center runs their nutritional program. So we go out there. So we're just trying to kind of spread the word and help go where veterans and their spouses and dependents are. Any questions for me?
I just have a comment.
Mm-hmm.
I think a lot of veterans and a lot of families are under the impression that the VA is going to pay for your funeral.
Mm-hmm.
That's obviously, we know that's not the case.
Mm-hmm. So VA has burial allowances, but with the criteria for that is you had to be receiving a veteran's pension, compensation, or something like that. And they have there's a non-service connected allowance, and then there's a service connected allowance. But outside of that, VA doesn't cover, and it's still not going to cover your full expense. For example, non-service connected is $2,000. Then there's a plot allowance that comes with it. I think it's $780. It recently changed, but they have some fact sheets on that. But yeah, they don't automatically cover anything. You can get a flag. Mm-hmm. And a grave marker. That's a grave marker, or they also do the little placards that you can put on there. But that comes out of Quantico, so you can get one of those with your DD 214. Mm-hmm.
I don't mean to interrupt you.
No, you're fine.
I think I would be remiss if I didn't bring this up. Any veteran who has passed away has DD 214 honorable discharge can contact the American Legion here in Wilmington, Post 10. They can ask to be in touch with the commander of the honor guard. Okay? We perform ceremonies for funerals, memorials, grave sites, churches. We perform hundreds of the playing of the taps, the folding of the flag, presentation of the flag to the surviving member or the member of the family designated. It's free of charge, and I've just retired from it, so but I would encourage you. Many people do not know that is available. And the ones who perform that service are all honorably discharged members of the military. It's done in uniform, and even if I say so myself, it's quite impressive. And it can be quite emotional.
And that's all, is there all counties, or what was the?
Yes.
Well,
Okay.
American
Post
Post
10
10.
of Hanover. However, however, there are surrounding communities to which we sometimes go. Okay, but anyway, that's for your information, and I hope that it might help some families.
If I
Yeah,
might
thank
add
you
one
for
more thing.
sharing. Yeah.
I'm involved with an organization that provides burial at sea for veterans and their spouses.
Mm-hmm.
If anyone is further interest in that, please contact me and I'll be happy to share that information with you.
That's awesome.
Veterans Wreath Memorial.
Yeah, I went to the ceremony you guys had at the battleship. Mm-hmm.
What is it called?
Of the Veterans Wreath Organization, and what, we provide burial at sea and an artificial reef off Wrightsville Beach. Veterans and their spouses are eligible. The veterans are cremated, their remains are incorporated into the artificial reef, and there's a weekend memorial ceremony honoring the veterans, and then they're taken out to sea and lowered into the ocean.
The Marstock divers, special forces from Camp Lejeune who were divers.
Mm-hmm.
Come and orient the reefs, and it's part of the Marine Fisheries, so North Carolina Marine Fisheries Association as well. So,
It's awesome. Yeah.
fantastic organization.
Mhm.
If anyone might be interested, I'll be happy to share some further information.
So as you can see, it's like a lot of benefits that veterans are eligible for. So it's very important that things like this, I'm so glad you guys provided us the opportunity to talk about that and share those things, because it's important to share that information and get together. Are there other questions? Yeah.
Not a question,
Oh,
but I think everybody also knows this probably. My daughter and I volunteer here, but it's, she responds all over the place, but we volunteer here locally for Canines for Service that provide service dogs for veterans for free.
Waterman's this week?
What?
You be a waterman's this week?
Tomorrow? What are
Next week? Yeah,
for
the service dogs.
Canines for Service?
Yeah, there's a fundraiser for
Oh,
service
I don't know
dogs.
what you mean. Okay, I saw something about that.
Mhm.
I'll be selling t-shirts.
Yeah.
Bye.
Any other questions, comments? Mhm.
All right, thank you.
Where do you want us to next?
Yeah, so I'll just cover the last things here. I don't know about you, but I'm very thankful I don't have Betsy's job. I listen to all the different facts and all the things that are different. That's why that table is filled with material. So if you haven't been back there, the table, the round table at the back has several of the documents that she's talked about, the books. And I saw some of you taking pictures. We do have the program online afterwards. So if you want to look something up later, or if you want to share it with somebody, we have the flyer that's about next month's program, and you'll see some different websites there. And so you can look up the events on that. You would just look at past events is I think where you would need to go. So on your table, you do have the flyer for next month's program. It's going to be on hurricane preparedness, but it's also going to be on the AFN program and registry. And that's about getting registered if there's some special needs that you have, some functional needs, medical needs that might make you more at risk in an emergency event such as a hurricane. And so maybe you don't need that now or don't have a family member that needs that now, but it's important to understand what that is. So when you do have that need, you can get on that. So take one of these home. I have some more I'm going to set on this table. So if you want to invite anybody to that, you can also do that. At the table, there's also the small quarter sheet. If you're not on our email list, so if you're not getting the emails, which will just be about these programs, go ahead and sign up for that. And you can leave that at the table or hand it to anyone with the ACAP shirt or Jen here in the front with the blue. And that way you'll get the emails to let you know about our programs. And then there's also the feedback form, and that lets us know how can we make these programs best for you. Any presentation ideas that you may have. ACAP has its curriculum that's already nailed down that we can pull from, but we can also come up with other programs and speakers if there's something you're interested in that's not part of that curriculum. And I would like to know, you can be honest about this, if the dinner was helpful for you to be able to come here, if you could just write that on there, yes, or something like that, so that we know if that's something that maybe we can look into for the future, because we really appreciate Bess bringing that from Emeritus Hospice. So thank you. And those forms also can go to any of the leadership team or to Jen at the front. So any other questions for Betsy or about ACAP in general? All right. Well, thank you so much. We hope to see you next month. And there's also one flyer that lists the different programs up through, I think it's August. We do have them every month plan further than that, and we'll have that next month. So thank you.